So thanks to everyone who's joined us today. We're going to go ahead and get started. My name is Gary Wanitzik. I'm over at the Institute with the TA Network, and I'm helping provide technical assistance to our friends at NICWA and our friends at CASE who are joining us today. And we have Emily Smith-Goring and Dawn Wilson, both from the Center for Adoption Support and Education, or CASE, with us today to present on advancing practice for permanency and well-being in child welfare. And this webinar is hosted by NTI and the National Child Welfare Association, which is a partner in the National TA Network for Children's Behavioral Health, operated and coordinated through the University of Maryland. And with that, I'm going to go ahead and hand it off to Emily to get us started.
Great. Well, it's great to have everyone here today, and we are going to spend some time talking about Adoption Competency Initiative, and we'll, of course, leave some time for questions at the end. So just to give you an idea of what we're going to be discussing today, we're going to be explaining the basic elements of adoption mental health practice and why it's needed. We're going to learn more about the approach of the National Adoption Competency Mental Health Training Initiative in developing a workforce training that really helps to better address the mental health needs of children and families who have experienced foster care and adoption. And we're going to become familiar with the instructional design elements of the online learning opportunity. Just a little bit before we get into the initiative, I just wanted to talk more about CASE for those of you who may not have heard of us before. The Center for Adoption Support and Education has been around since 1998, and we have historically provided adoption-confident clinical services in the Washington, D.C., Maryland, and Virginia area, and now have several other offices in the northeast part of the United States. We provide adoption-confident training for professionals, as well as publication and educational programs, and life skills programming for transitional youth. So we've been in this field for 20 years now, and really in an effort to spread this information throughout the country, we've gotten into training and helping to train therapists and child welfare professionals. So that's what we're going to be talking about today. These are our partners in this initiative that we're going to be talking about. We have partnered with the Children's Bureau. This is a federally funded project that we're going to be talking about today, the National Adoption Competency Mental Health Training Initiative. And through the rest of the webinar, I'll just be referring to it as NTI. That's the abbreviated term. We've had some great partnerships with others in the adoption field, such as the Dave Thomas Foundation. We've worked with evaluators at the University of Maryland and NICWA as well, and many other advisors and experts in the field of adoption. So with that, I'm going to turn it over to my colleague Dawn, who's going to talk a little bit more about how we came to this initiative and what some of the issues are in the field.
Thank you, Emily. So as Emily mentioned, CASE has been in this field providing mental health services to families experiencing foster care, adoption, and guardianship for 21 years. And during that time, we've worked with probably 6,000, maybe, families, individuals over all those years. And one of the things that we have really experienced is we hear continuously from adoptive parents when they come in for therapy is that in many cases they've been to multiple therapists before they found one that really could meet their needs. And this is borne out by a number of other surveys as well that have been done across the country by a number of different organizations. This idea that parents and families are experiencing competent mental health services is one of their greatest unmet needs. The American Academy of Pediatrics has also identified mental health as one of the greatest unmet needs for youth in foster care. And you can see from this slide that they estimate that 30% of children in foster care have severe emotional, behavioral, and developmental problems. And so when we talk about working with children, youth, and their families experiencing foster care, adoption, and guardianship, we want to make sure that they have professionals who truly understand their needs and can address those needs in a way that really supports them, allows them to be successful and stable. This is an example. This is actually a quote from a client that we served a case. This is a young man who said, "I was sitting in the hospital after trying to kill myself, and the social worker lady told me I should be happy that I was adopted, as my parents had gotten me out of a horrible orphanage." Now, this statement may in fact be true, that he was removed from a horrible orphanage, but this kind of comment from a professional is an example of, I think, what often children and youth and their families experience, and that is someone who doesn't truly understand the emotional difficulties that this young person, teenager, is going through in terms of really understanding who they are and, you know, why aren't they with their birth parents and what was wrong with them. And they may have all these kinds of thoughts going on in their heads, but if the professional doesn't understand that and can't really help bring those issues to light and help work through those issues, then we're not being helpful to families. And in many cases, what we've heard from families is that in some cases, therapists have really done more damage than good. One of the things that we've learned over these years, and I think is really apparent in the training that we're going to talk about in a little bit, is that if professionals can't acknowledge the impact of loss in the life of young people who experience foster care, adoption, and guardianship, then they're really missing the opportunity to help young people heal. And I think it's important for us to really understand that this idea of loss creates a number of different complications and challenges and themes in the work that young people must do in terms of figuring out who they are and how to move forward with new families. And it's important for us to understand that young people may have lost, depending on whether, of course, this is an inter-country adoption from child welfare. Some of these things are even true in guardianship and kinship placements as well. But they may have lost their culture and traditions. They may have lost their language, their religion, their racial connections, their siblings, medical information, birth legend, birth order, this whole idea of who they are in their family, genealogical continuity, being connected to someone genetically. And all of these things can really bring to light for young people a lot of difficulties. And if we don't recognize that and can't address it, then we're going to really have a hard time supporting them in their healing. Understanding and adjustment to adoption is influenced by a number of factors. Among those would be the child's emerging cognitive capacity. And so we have to remember that because of the trauma and early adverse experiences that many children and youth have experienced, where they are cognitively doesn't necessarily match their age. So that's why we often talk about stage-appropriate development. It depends on their developing coping skills and the kinds of ways that they have handled the difficulties they've experienced in the past. And also, their adjustment to adoption is influenced by the opportunities that exist for them to communicate about their thoughts and feelings. And so in families where this is not encouraged, where folks really don't feel comfortable talking about maybe missing their birth family, for instance, it's going to be much harder for them to adjust to adoption than in families where that communication is occurring on a regular basis and is encouraged. What happens often for young people, and in particular as they reach adolescence, is that they experience what we would consider stuck spots. So there are 6 main themes that we see often with young people, and that is they're really stuck on trying to sort of figure out why they're in the situation they're in the first place. What is the reason for their adoption? Why aren't they able to be with their birth parents? This often also includes this idea of what do you do with missing and difficult information? In many cases, children don't really have much information at all about their birth families and their culture or their community or how they came into care. In other cases, particularly for those in the child welfare system, they may know a whole lot about their birth family. They may have lots of memories, but there still may be missing information that just hasn't been provided to them or isn't known even by the system. There's a lot of concern about difference, this whole idea of feeling different. In some cases, you'll hear kids talk about, you know, I just feel different, like I feel like I don't belong, or you know, that I'm not really connected in the same way as maybe my siblings or other people in the family. And then on the left side, we talk about things like identity. And what we know is that for adopted youth in particular, this whole experience of forming identity is much, much more complicated. You know, for those of us who know who our birth families are, we kind of know who we look like, and we know who who we have characteristics in common with. But for adopted youth, that's often missing and makes it very difficult for them to really, have a strong sense of identity. Permanence for young people, particularly for those who are adopted at older ages, this sense of, is this truly permanent? What does it mean to be permanent? Very often families think that they're providing what they consider a safe, loving environment, but physical safety is very different from emotional safety in the sense that, yes, this is my true forever family and that it is unconditional. That creates a lot of difficulties around permanence, particularly as people start to approach what for a lot of young people is sort of, independence, going off to college or moving out of the house. That creates a lot of, in some cases, anxiety for young people because they are trying to connect and get a sense of belonging with the family. At the same time, they're trying to separate, which is very complicated. And then, of course, this idea of loyalty. And again, this issue can be much more complicated for those who have very strong ties to their birth family, community culture. This idea of, am I being disloyal to my family by connecting with this new family? Or, if I allow my grandmother to be my parent, am I being disloyal to my birth parents? Those kinds of things. So part of what we need to do is we need to make sure that we have professionals who truly can help young people and their families negotiate these stuck spots, can really help them work through the feelings and thoughts that they have that make it difficult for them to, move forward. So I don't know what happened there. Okay, what we know. So as I mentioned a minute ago, communicating about adoption is key to adoption adjustment. Having families and professionals who understand that and can support that is really crucial. Adoption transposes or transports adopted people from one location in the human mosaic to a totally new configuration. So think about this. We all exist in the context of our families, but we're taking children out of that context and putting them in an entirely new context. And in some cases, we're just assuming that they should be able to, be okay with it and figure it out without having the supports in place. And that's a lot to ask of young people who often don't even understand why it's happened in the first place. And the thing that I really want to say here, because sometimes when we share statistics about the need for mental health services, we get the sense, or people get the sense that adoption is somehow pathological. And that is certainly not the case. We want people to understand that the issues that are associated with adoption evolve logically out of the adoption itself. So again, this idea that every child who's experienced adoption has experienced loss. In many cases, they've experienced all kinds of adverse experiences or abandonment or rejection, in some cases maybe from multiple families, depending on their experiences. So it isn't the adoption itself that's problematic. It's whether or not we have the supports in place to really help youth, their families, understand and address the issues that kind of brought them to where they are and can help them move forward to be successful and stable. So what do families want and need? We'll talk a little bit about that. We're going to watch this video from
The girls were assigned therapists from their county, which was not the county we lived in, so we had to travel out of county every week for their therapy appointments. One of my daughters, who has a significant history of sexual abuse, was assigned to a male therapist, which I found frustrating because she was terrified of men. But we would take them. We were doing what we were told by the social workers, so we took them to therapy every week, and they each went into their own therapist, and I stayed in the waiting room, and then they were brought back out to me when they were done, and we didn't know any better, so that's what I did. But I'd ask, so what did you talk about? And they said, well, that's confidential. And I said, oh, well, how can I help them if I don't know what you talked about? And so we would take them home from therapy, and we'd have huge behaviors in the car and a lot of self-harming behavior for one of my daughters. and a lot of kind of acting out aggressive behavior from the other, but without a lot of guidance in terms of what was happening. It was like kind of this big secret that was going on in there for 45 minutes every week that we weren't privy to. It was very frustrating.
Great. So this is, again, the experience of one adoptive parent, but it does mirror what we hear often from a lot of families, and that is they don't know what's happening in the therapist's office. They're not included in the therapy. There's not any communication involving the parents and the child together. There's not any work being done between the child and the parents. And that makes it really difficult for families, parents, to be able to support the healing of their children and youth if they're not a part of the actual therapeutic relationship. So what CASE really was involved in was a federal initiative that allowed us to address this issue by developing training that would be available for child welfare professionals and mental health professionals to really help them understand the needs of children, youth, and their families experiencing foster care, adoption, and guardianship. So our charge was to create this curriculum, this training. We delivered this training through our pilot sites, which Emily will share some information about. We implemented certificates of completion. We provided CEUs for folks who completed the training in our pilot sites. We got information from them through our evaluation, and then based on that feedback from our evaluation, we also made revisions to the curriculum. So we got input. Not only on the front end did we have all of our national advisors help us develop the training, but on the back end we got feedback from those who took the training and then made the training even better based on their feedback. This training is based on a number of guiding principles, and we sort of highlight just a few of them for you here. This idea that adoption is lifelong and intergenerational. It is not a one-time event. There are experiences throughout the life of a family that may come and go, and we need to help folks sort of acknowledge that. Again, as I mentioned earlier, loss and grief are central to the experiences of those families. Secure attachments can be built and rebuilt, and we believe that firmly, that we can, in fact, help families, even those who have had really difficult attachment bonding challenges, to build, rebuild secure attachments. Identity formation, as I mentioned earlier, is much more complex, particularly for adolescents experiencing adoption. Race, ethnicity, culture, class, gender identity have a unique role and can, in some cases, create additional challenges for families, and we want to make sure that folks are prepared for those challenges and can address them, particularly when we talk about transracial, transcultural placements. Special training is needed for these families. We believe that firmly, and it's why we created this, this product. And there are more guiding principles as well in our training, but this sort of gives you an idea of sort of the core. The other thing that's very important to us is that while training is wonderful, we don't just want to train people, we really want a system impact. And so by having aligned curricula for child welfare and mental health professionals, NTI is allowing those professionals to speak a shared language and to collaborate in a way that can better serve the needs of children, youth, and their families. And that's really important because we know in our work that the same families are often served by child welfare and mental health professionals. They're often served by the courts as well, education systems. But we want those professionals to do a better job of collaborating, working together to meet the needs of children and families. And this is sort of a nice, I think, graphic of kind of what we're talking about, that if professionals don't have the right skills, if you hand somebody who's drowning a bar of soap, it's not going to help them. We want to provide the right tools, the right skills and strategies to professionals to really help them meet the needs of families. And the same graphic could apply for the families too. If we don't provide those families with the right tools, skills, and strategies, then we're not giving them what they need to be successful, stable, forever families. So the bottom line really is that we're building competencies and skills to enhance permanency and well-being for children and families. And I think now I'm going to turn it back over to Emily.
Thanks, Dawn. So Dawn did a great job of talking about why we really needed these trainings. And so I'm going to talk a little bit more about what we created and the content, and then also talk about the evaluation in our pilot sites. So to address these needs and help create this system change, as Dawn mentioned, we created 2 online trainings. And one is for the child welfare professionals, one is for mental health professionals. So these are aligned curriculum that cover the same core concepts, but they're not identical. They're for different audiences. So they're extensive foundational trainings. And the child welfare professionals one, you'll see it has 8 modules. It's about 20 to 23 hours of training. And the mental health professionals training has 10 modules and it's about 25 hours. So the real main difference is that for child welfare professionals, the core concepts are really focused on casework practice, whereas for mental health, it's more focused on clinical practice. So the clinical practice has more of a focus on assessment and treatment planning. And really who this is appropriate for, we made it appropriate for a broad range of professionals. So in child welfare, it's really professionals across the continuum that have been taking the training and participated in the pilot, all the way from child protection intake workers to post-adoption workers. And then on the mental health side, the pilot participation again was broad, where we included anyone that works in a mental health role. So this could be a licensed clinical therapist. It could also be workers in residential treatment that may not be licensed professionals, but they work in a clinical capacity. So to give a little bit idea of the aligned competencies, we've listed them out here on this slide. So the competencies line up with one of each of the modules. So we have 8 competencies for the mental health professionals, or for the child welfare professionals, and 10 for the mental health, and that's in alignment with each of the modules. And so really these are aligned with what Dawn talked about the needs of kids and those stuck spots, as well as some of that, a lot of that loss work that we have to do. So it starts off, we talk about understanding children's mental health challenges specific to this population. We have a module on loss and grief, the impact of trauma and brain development. Building strong attachments is a module. Positive identity formation, so that really gets at that stuck spot around identity. The impact of race, culture, and diversity is a really important module. And there's a module on providing post-adoption supports. And so the 2 additional ones that you see for the mental health professionals are on that assessment and treatment planning, and then therapeutic parenting strategies. So this just gives you a bit of an idea of the competencies that we address in the training. And also available on our website are the detailed learning objectives for each module that we developed for the training, as well as the names of the lessons within each module. So each module is split up into lessons so that it's in more digestible form, shorter time periods, because we know that these professionals are often, squeezing training in between other appointments, and so we really wanted to make it digestible for this audience. And this next slide just gives you an idea of some of the evidence-based interventions that we talk about. This is just a sampling, so we're often asked, is this an evidence-based training? The training itself is not yet evidence-based, but we do definitely infuse that throughout the training. And we talk about different tools and techniques that can be used with this population that have been research-based and found to be effective. And we also talk about these clinical interventions. So you'll see that TBRI is talked about, TheraPlay, ARC, TFCBT, and many others. And really the structure is set up so that we provide an overview of different models that might be effective. And then if the participant or the learner wants to become more professional or specialized in one of these different models, we have links and resources that take them to more information about how they can become specialized. And just to give you an idea of what the training looks like, we've included this screenshot here. Of course, encourage everyone to go on our website and take a demo, and you'll see at the bottom of the screen we'll put the link in the chat box, but there's a demo on our website at adoptionsupport.org. You can go do a module and a lesson. And this is an example here of how it looks. So this is lesson 3, helping children and youth create their life narrative. And there's an activity here embedded. This is just an example of an activity of storyboarding. So storyboarding is an activity that we talk about in this module that can be used with children to help process their life story and process some losses and help them sort of understand more about their story. So that's just one example of many. And this is a little bit more about how to storyboard. So we even provide a resource print-off. So lots of resources are embedded throughout the training. And in this case, for storyboarding, we have a PDF in the training that can be downloaded if someone wants to use our storyboard template. And there's 6 blocks on the storyboard. And so in each block, it's a scene of a story that is part of the child's life. We also include in there a lot of different case examples. And so in this storyboarding example, one thing that we've led professionals through as we do this, do an example of the training, is the Billy Campbell story. And he is a case study that is mentioned throughout different aspects of the training to revisit his case study and his life story to help the clinicians really think about how they might use storyboarding with an actual case. And so using pictures, words, numbers, and images, the professional can work with the child to talk about their story, to ask them to outline those 6 blocks that they feel are most significant. And this can be linear, but it doesn't have to be. It can really be what the child thinks of as these important elements of their story. The final frames can be future-oriented. They're often inspirational or a summary. And again, this is just one of the many tools that's talked about that we just wanted to provide an example of here today. So a lot of really hands-on skills are embedded in the training to give professionals things that they can actually then take and work and use in practice, not just theoretical ideas. So really a lot of the core messages in NTI is that professionals have this critical role in helping children to understand their stories. So you heard about that in that storyboarding example as one way to help them with that. There's really this role of parents understanding the impact of grief, loss, identity, and trauma, and then how they can then work with their children. Also helping parents reframe their children's needs, and helping parents honor and maintain connections. So a real strong emphasis on how do you maintain healthy connections with important people in the child's life, important birth family members, and really how do you incorporate parents in being a part of that. Some other core messages is really learning new tools to support healing. So, one of the things that we like to make sure that we did when we developed this training is that we're not proposing a new model, right? This is really looking at foundational across the field, what has been found to work, and what are some skills and tools that are available already for professionals to use. So this isn't a new model. It really focuses on neurobiology and ACEs, so that's definitely embedded throughout. Therapeutic parenting strategies that differentiate can't versus won't behaviors. So I'm sure many of you have probably heard of those before, but really helping parents reframe that it's not that their child won't do something, but it's potentially that they can't. So really helping reframe that, and also helping professionals and parents understand the big picture when it comes to this lifelong journey of adoption. So really, again, this idea of what is in your toolbox and how do we develop a training that builds the toolbox. So again, not training on a whole new model. And we've had different agencies that we've worked with talk about, how does this fit for us? We're already TBRI trained. And so really our emphasis as we were developing this training is creating a one-stop shop and a toolbox that can be developed. And the training platform that we used is really meant to be engaging. And as I mentioned, there's really these important elements around resources that are embedded throughout. And you also heard me mention making sure that there is application throughout the training. So you're not just sitting and watching a training passively, but the idea and the design around the curriculum for both audiences was that it's interactive and it requires participation, it requires reflection, and really that adult learning principles were incorporated throughout so that there's active engagement. There's sort of a decision to explore more resources if it's a topic that that person is particularly interested. And so that's the training platform that we built it on and really worked on making it interactive. And again, you know, understanding that this is for adults and we want to make sure that it speaks to how adults learn. So this development of this training, as you can imagine, an 8 to 10 module curriculum, 20 and 30 hours, this really was quite an investment and really a long time commitment. So our initiative, I'm not sure that we mentioned this, it was a 5-year federally funded initiative. And really the first 2 years were around development of the curriculum and identifying what those core competencies were, bringing experts in together. And so, you know, once we identified those core competencies and started to develop the curriculum, we then needed to produce it. So online training takes quite a bit of investment in terms of the production elements, even once you have an idea of the content. So after we put all that time and investment into the actual curriculum development and the production of the curriculum, we wanted to pilot it and make sure that this was effective. And so the pilot was a really instrumental part of this project because we were not just, you know, piloting it, we were also doing an extensive evaluation that really looked at the effectiveness of the training and how it impacted practice. So I'm going to talk a little bit about that now. And I already mentioned that timeline here. So we started to pilot and evaluate the curriculum in 2017. We did start with a child welfare pilot first, and then did a mental health professionals pilot. And so after we did the pilot and the evaluation, we really dug into the data to look at the effectiveness and what sort of changes and modifications needed to happen. And so we spent much of 2019, some of 2018, really working on those curriculum revisions. We had to reproduce some of the content based on feedback. And now we're in the phases where, you know, it's completed and we're launching it nationally. So Don will talk a little bit more at the end, but that's sort of where our 5-year timeline was. And we piloted it across 9 sites. So we had really diverse states, and we had diverse child welfare and mental health systems that we piloted in. You'll see the states here highlighted in green: Washington, California, Oklahoma, Minnesota, Illinois, Tennessee, South Carolina, and Maine were all pilot sites, and we had some really excellent partnerships with the state child welfare systems there. We also piloted in Cherokee Nation in Oklahoma, and we had a pilot with NICWA membership. And we thought it was really important for us to get feedback from tribal sites and participation from diverse sites so that we could really make sure this was relevant across the country. Here you'll see the top 3 administrator reasons for why they wanted to participate in the pilot. So we really found that these pilot sites were really ready for training. A lot of places were just really wanting some new training for their staff. And so they talked about wanting to participate in a pilot to improve the outcomes for children and families. They wanted to use data to improve performance. And then they also wanted to receive professional training without expending fiscal resources. So that may not come as a surprise. We all know that we're pretty cash-strapped in our systems. And so to have this free training opportunity was really important to them as they looked for more staff development. So let me just provide a brief overview of our evaluation. We were really pleased with the participation numbers, and I think it really far exceeded our expectations. We had over 6,000 child welfare professionals participate in the pilot and almost 3,000 mental health professionals. And so we really got some great feedback that helped us as we refined this. And our completion rates were also really high. So really for online training, best practices that they're around 3 hours, and completion rates aren't very good. And so for us to get completion rates of 72.5% to 69% on the mental health side, and this does not factor in turnover. I mean, these were really great numbers. And so again, the data that we got was really good. So overall, what we found in the evaluation was that NTI increased knowledge on all of the core competencies that we identified, and that there were actual changes to child welfare and mental health practice as a result of NTI. So this was really encouraging, and I'll dive in a little bit more to what those changes were that we saw. So you'll see here on the chart, this is the child welfare professionals pilot findings, and we had a pre-test before each module and a post-test after each module. So we were really identifying what are those learning gaps up front, and then after taking the training, as a result of the training, what were those knowledge gains? And you'll see here, at the onset of the training, really there were low pre-test scores, lowest in that module 5 for child welfare professionals around the impact of loss and grief. So really critical content and learning that needed to happen there. We were, of course, really pleased to see that at the end of the modules, those post-test scores had substantially increased and were in the 90% passing range. And more importantly, though, we had a qualitative element to the evaluation where we dug in further to what was the impact on child welfare practice. And so some of the themes that emerged around that with our participants was that in the child welfare setting, the professionals talked about how NTI had impacted their recruitment, training, and selection of foster parents. It had improved assessment and referrals. It had led to more honest communication and understanding with youth and caregivers. And it improved their confidence and self-efficacy as they worked with clients. So there are a lot more details on our website and in our evaluation reports that dig more into what each of these thematic areas were and provide some more evaluation. But this was really encouraging. There were some really great findings from the evaluation with the child welfare professionals. So we also did very similar evaluation with the mental health professionals, and again looked at those pre-test, post-test knowledge gains. And you'll see for mental health professionals that at the pre-test, there were really low competency scores on modules 5, 6, and 7. So that's the modules on attachment and child development, the module on race, ethnicity, culture, and diversity, and the module on identity formation. But you'll see across the board, across all 10 modules, no one was, on average, there were not passing scores on any of the pre-test modules. Again, we're really pleased to see that after seeing the modules, there were substantial knowledge gains, and for the most part, everyone was passing in the 90s, score in the 90s out of 100. So the knowledge gains, we were, very pleased to see that. But of course, again, what we really wanted to know more about was the impact on practice for mental health professionals. And so you'll see here some more of the themes. There was really reports of competency improvements and really, relevant skills, reinforced the skills or improved skills that they had. They talked about how it was relevant for their work beyond adoption, that it improved competency in working with clients, and overall increased that awareness of adoption issues. And then the themes around knowledge talked about, cultural awareness, more knowledge in grief and loss, trauma, and incorporating parents. So again, there are a lot more details on our website and in our evaluation reports, but these themes that emerged really helped us see the ways that the training had actually impacted the mental health competency with these professionals. And then we did a lot of evaluating, how the system worked for them. So how did online training work? We looked at the level of difficulty, level of interaction, this idea of ease of use. So was it easy to access the training and use it and navigate through it? And we were really pleased with the scores that we saw, the overall satisfaction. People, rated in the 90%, they were extremely or somewhat satisfied. The area where folks really struggled the most was in the overall length. And we realized that, part of that was in our messaging, that professionals weren't really used to taking this length of an online training that required the amount of interaction that our training required. So the field sort of needed some more education and training around how to take an online training and how to prepare for it. And that you really do need protected time and protected space to participate in this training. So that's where, a lot of our lower scores came in around the overall lengths and weren't as satisfied in that. But we were really pleased that 100% of our pilot sites reported that they're going to continue to use and sustain NTI with their staff. So many of our sites are mandating a training with new child welfare professionals in the field. We've had some interest from our states that we piloted with in using it with 4E students, and in other states starting that discussion. And with foster care contract agencies that maybe have clinicians on staff they use both the child welfare and mental health training with their staff, sort of depending on what their roles are. So we've been really pleased with the amount of sites that participated in our pilot that have continued to use it and continued to embed it into their training system and their training plans. And so we're going to hear from Debbie one more time here about what it was like for her as a parent after she received services from someone that had specific training in working with families formed through adoption.
To say it was like night and day is an understatement. We had a therapist who was an absolute godsend. She really understood all the nuances, all of the complexities of adoption, of children growing up in a family they aren't born into. She had personal and professional experience in adoption. She had specialized training in the issues surrounding adoption and permanency. And so she really, really got it. And for starters, she included me in the therapy. So we were in there together, and she was helping to kind of coach and facilitate me doing the healing with my kids, because she recognized that I'm the one, and my husband is the one, who's living with them 24/7, and they're not going to just heal during that 45, 50-minute session once a week. But we started doing a lot of attachment work, which I didn't understand at the time. I didn't really know what it was. I can remember having some of it feel kind of awkward and not knowing quite how to do some of that stuff with lotion on my little girl's hands and holding her like she was a baby. And I'm like, really? Is this really what we're supposed to be doing? And she's like, yeah, trust me. But I did trust her because I saw the difference. She really got it. And she understood when my kids were sharing something that was happening and I knew that their version was absolutely not accurate. She taught me how to just wait with that, and that to trust her, that she knew what she was doing. It didn't mean that she believed what they were saying, hook, line, and sinker. It meant that she was getting lots of other helpful information about how they were feeling by the way they were describing it. So she taught me a lot. She taught me not to talk so much. She's like, no, Debbie, you didn't talk. No, the kids are not learning through your words. She spent a lot of time checking in with me when we'd first go so that I could, cry or rant or brag or whatever it was about what was going on that week. And then we would welcome my child into the room, and then we would do that family work together. But I largely credit her with keeping our family together, because we had some very, very difficult times with some really, really big behaviors that I think would have unraveled a lot of families. But having somebody who really got it and having a safe place to take that without being judged was hugely helpful.
Yeah, I think we got, we all kind of got a little bit of an idea of what she was communicating. So Debbie here, this parent, really is sharing her story of how once they did get connected to Adoption Confident Professional, that, she was really incorporated and given the skills to then work with the kids at home on attachment and became a critical part of the therapy. And so that's what, we really hope with NTI, not just that, there were knowledge gains, but that there are those practice changes that then trickle down to the families so that the families are then given the skills. And that's really the point of the initiative and the overall goal of NTI. And so the evaluation was a really critical point in us to understand how the training was working and if it was. And so we've been very encouraged by the results that we found and feel like the feedback that we got from those over 9,000 professionals has really been critical in understanding the effectiveness of the training. So I think, Dawn, now I'll turn it back over to you just to wrap up and talk about where we go next from here.
Sure. Thank you, Emily. So the bottom line here really is, as Emily has said, and I know we didn't get to hear all of Deb's show, but the idea really is that when professionals have the right skills, the tools, the strategies, understand the needs of children, youth, and their families, the kind of work they can do can really be transformational. And when we think about what we want to accomplish with NTI, we really wanted to highlight sort of what the goals are that we're working toward with this training. And those of you who are familiar with the Children's Bureau sort of vision for child welfare, which has sort of moved more from the back end, if you will, to the front end in terms of prevention work and making sure that kids don't come into foster care if they don't need to, which of course we would all want that to happen. But the fact is that we still have children and families in our system who need our services. And so what we want to accomplish with NTI, we believe aligns with the goals of the Children's Bureau. So first and foremost, we're focused on family stability. We want to provide families with the supports they need to be successful and to remain stable, to be long-term, forever families. We want to focus on honoring and maintaining birth family connections. And for some people, this may seem sort of oxymoronic, that we're focused on family stability with the adoptive family, but we're also honoring and maintaining birth family connections. But in fact, the opposite is true. We know that when we can help children and young people honor and maintain connections when it's safe to do so, whether it's with birth parents, extended family, other kin, fictive or relative kin, that helps young people heal. And we would include in here not just the birth family connections, but I would also say community and culture, that we want to keep kids connected to their family, community, and culture to the extent that it's possible. In doing that, we also focus on child and family well-being. So we, of course, want to help children heal, and we want to help families be successful, as you just were able to hear part of what Deb Shug was saying, what was really impactful in terms of how therapy changed. And of course, we want to make sure that there are available appropriate services and systems that collaborate. So we don't want families served, we don't want families served in isolation. We don't want children served in isolation without their parents involved. But we also want families to be part of, to feel that they're part of the greater community, and for professionals who work within that helping system to be able to work together to support children, youth, and families. And the bottom line really for this is that what we really all want is we want skilled, competent workforce. And we believe NTI can really address helping all professionals, child welfare, mental health professionals, regardless of whether they have a license or not, or a master's degree or not, that this is training that can really help them to truly understand the needs of children and families and can help support and address those needs in a way that is more effective, beneficial for families. In terms of system impact, we want to enhance collaboration, as I just mentioned. We want to enhance casework practice. So for child welfare workers, we want for child welfare workers to be able to do work that actually enhances their ability to support children and families. So in whatever role child welfare professionals are working in, whether it's on the front end, back end, in between, whether they work with the children, the youth, the families, do licensing work, home studies, whatever their role is, that they can do a better job of providing that case support to families. We also want to improve assessment and treatment skills, treatment planning, and interventions and strategies and tools that are of a clinical nature for children, youth, and families. And for those mental health therapists that are interested, we also want to help in the development of what they might consider sort of a specialty clinical practice. And we want to see this happen across the country, right? So that folks don't have to depend on just one good provider, you know, who maybe gets it, but the rest don't. We want to expand the ability of families, no matter where they are, rural, urban, across the country, to be able to have access to competent, skilled clinicians and child welfare professionals. So where we are right now is, as Emily mentioned, we have finished our pilot, we made revisions in the training, and we are in the process of getting ready to go live. When we say live, we mean making this training available nationally to states, tribes, and territories. And there are a couple different ways that folks will be able to access this training. One is this training will be available on what's called the CapLearn Online Training Center. That is the online training center that the Children's Bureau funds. We're in the process right now of finalizing what's called 508 compliance for our trainings. And this is the accessibility, the federal regulations that govern how the training can be accessible by people with hearing, sight challenges, aren't able to use a mouse, that sort of thing. So we're finalizing, making doing the review and making the changes that need to happen to make sure that it meets all the 508 compliance requirements. And once that happens, it will go live on CapLearn. And those of you connected with this TA network will be notified. We'll make sure that we get the word out to everybody when the training does become available on CapLearn. We're also working with state, tribal, and territory child welfare systems, mental health systems, interested in making this training available via their own internal learning management system. So, for instance, we're working with state child welfare systems who want to put this training on their learning management system so that their public and, in some cases, private clinicians will have access to the training, or that child welfare workers would have access to the training. And that looks different in different states because we're in different places with each state system regarding whether they can, in fact, load this training onto their learning management system. So that's a process that we're going to be working on over this next year. We do have a page on our website, and I know Gary did post where you can get our demo. If you go into the NTI website, there are other pages that you can also access. One of them has to do with access for individuals and access for organizations. We will also have a place on there where we're going to, we're going to be posting which states are integrating this into their learning management systems and who the contact is for that. So if you're in that state and you want to know if you have access to that training, you will know who to contact to do that. So our strategy really is to get this training out to as many people, as many ways as we can to make it available to them. And our hope really is that child welfare professionals and mental health professionals across the country are accessing this training, which is free of charge. There is no charge for the training, so that they can do more effective, better practice with children, youth, and their families. So, Emily, I'm going to turn this last one over to you.
Great.
And take some questions.
Yeah, thanks, Dawn. I think we have time now for questions about the initiative, the evaluation, any of the topics that we covered here today. And I believe Gary was going to unmute the line. So if you wanted to ask a question verbally, you could do that, or you can also write your questions in a chat box. So does anyone have a question at this time?
And lines are officially unmuted now if you want to ask a question over the phone.
And we just ask, say your name, maybe, and your location, and then state your question or comment.
Emily, can I make one clarification?
Absolutely.
If anybody wants to think about a question, they can. I noticed when we talked about the length of the training, I just wanted to make sure that we let folks know that because of some of the revisions that we made in the training technically is considered 20 hours for child welfare professionals. For the child welfare supervisors, because we have additional lessons that help them support their staff to apply what they're learning in practice, it's considered 25 hours. It may not be exactly 25, but it's close to it. And then for mental health, we've increased it to 30 hours. And again, may not be exactly 30 hours, but we're sort of erring on that side because we did add some clinical pieces that relate to, in particular, fetal alcohol spectrum disorder and the impact that that has. And then we also beefed up some of the other clinical pieces based on feedback from our pilot. So I just wanted to point that out for folks.
Thanks, Dawn. That's helpful. Are there any questions? Well, if there's not, I just want to emphasize again that a lot of this information can be found on our website, adoptionsupport.org/NTI. We also have the presentation slides available for download. That's in the files box below the chat box, so you can click on the file name to download those files if you're interested. And please don't hesitate to reach out to Dawn and I at the Center for Adoption Support. I will type our email addresses into the chat box for anyone that's interested. All right, and I guess if there are no questions, we will end the webinar for today, but I just want to thank everyone for being here and being a part of the presentation, and we hope to connect with you all soon.
And just a reminder to take our survey. It'll open up when I close up the meeting, but I want to give you some time to grab Emily and Dawn's email addresses if you want those. And Vicki, is there anything that you wanted to add before we close out today's webinar?
I just want to thank everybody for joining us, and Emily and Dawn for that wonderful presentation. And I hope everybody goes on their website and joins in and gets involved in this training and gets the word out. So thanks everybody for joining us today.
Thank you.
All right, and we will be sharing a recording from today's session back out with Vicki and everyone who participated or registered for today's webinar. And with that, we'll go ahead and close out the meeting. And once again, please go ahead and take our survey. Let us know what you enjoyed about today's webinar. Thank you.